The shade is determined by means of the chromoscope shade guide. The living tooth mold charts provide further assistance in selecting the appropriate shape and shade of the teeth. The initial situation. The current oral situation of the patient shows clear deficiencies. This finding is confirmed by the profile, the physiological rest position, and the centric position. Initial impression. After examining the anatomical oral conditions, position the empty mandibular tray on the mandible and check if the tray smoothly runs along the alveolar ridge without causing any pressure spots. Then insert the maxillary tray and again check the fit of the tray. It is advisable to use a hand-mixed alginate to take the first impressions. Centric tray. The centric tray permits the transfer of the occlusal position to the individual impressions. In addition, the tray allows the physiological unity of the stomatognathic system to be maintained. To record the occlusal height, apply marks on the nose and chin of the patient prior to impression taking. Record the distance between the marks with a sliding caliper. Slide the support wings onto the retraining track from the dorsal. Dry in the centric tray and trim off any interfering areas. Mix impression material and load both halves of the centric tray. Insert the centric tray sideways into the oral cavity. Advise the patient to close the mouth slowly until the marked occlusal height is reached. The mandibular and maxillary impressions are sent to the dental laboratory together with the centric tray. The gnathometer M with the UTS adapter, the intraoral registration of the Gothic arch, is an efficient way of determining the maxomandibular relationships in edentulous patients. Check the individual trays with the bite rims in the oral cavity. The bite rims should close completely with the load being evenly distributed. Next, take the individual impression using a silicone impression material. During impression taking, the antagonist tray remains in the oral cavity. In this way, the correct relation for the subsequent registration is taken into account. The Universal Transfer Bow System, UTS, has been developed on the basis of scientific principles. The UTS is a recording system that can be adjusted to various reference planes. It is a fact that there are smaller and larger jaws. Depending on the skull size of the individual patient, the individual Bonwell triangle may vary by up to approximately 50 millimeters. The UTS permits the transfer of the spatial position of the patient's Bonwell triangle to the joint components of the articulator. The UTS is suitable for model orientation according to Camper's plane, the Frankfurt horizontal, and the sagittal median plane. Mounting the UTS. In the present case, the Camper's plane was selected as the reference plane. Insert the earpieces into the external auditory meatus of the patient by slowly pushing the side arms together. Position the nose piece with the corresponding nose pads on the glabella in such a way that the bow sits tight. Adjust the reference plane indicator according to the spina nasalis by adjusting the height of the nosepiece. Check again if the transfer bow sits tightly and if the desired reference points are in line. Next, insert the open registration joint into the guide at the transfer bow, and the other end into the UTS adapter of the registration and tighten the corresponding screws. Subsequently, loosen the locking screw from the side arms and the nosepiece. Pull the lateral arms apart and remove the appliance from the patient. Then, remove the bite rims and replace them with the registration plates. Insert the plates by means of pointed pliers to avoid damaging the impression margins. To carry out the needlepoint tracing procedure, remove the maxillary impression from the oral cavity, remove the registration plate, and coat it with a thin layer of wax paint. And insert it again. The registration plate with the tracing point is placed in the mandible. Check the vertical relation. If necessary, adjust the relation by turning the registration screw. One full turn results in a vertical adjustment of 1 millimeter in the anterior region. After adjusting the height, check the distance between the dorsal ends of the two impression trays. The trays or excess material must not come into contact with each other. The movements of the mandible should not be impaired. Now instruct the patient to carry out the following movements. Protrusive movement. Move the mandible forwards and back again. Lateral movement. Move the mandible to the left and back again. Lateral movement. Move the mandible to the right and back again. Remove the registration from the oral cavity and check it for accuracy. To carry out the final check and to secure the registration, place the securing lamina on the registration with one of the openings located above the needlepoint centric tracing. Perform a visual check in the oral cavity by means of repeated closing movements to make sure that the registration pin slides into the corresponding opening of the securing lamina. Confirm the position by having the patient repeat the closing movement several times. Next, make a record of the registration with fast setting plaster. During this procedure, the registration pin has to be located inside the opening of the securing lamina in the mandible. Only the lips are slightly apart. Make sure that the UTS connection remains clean during this procedure. Carefully remove the entire registration from the oral cavity. The UTS and the registration are sent to the dental laboratory. The registration joint holder can be used as an alternative. In this way, the UTS does not have to be transported to the dental laboratory. Try-in. Check the wax dentures according to the aesthetic cosmetic, static, functional, and occlusal principles. When trying in the wax dentures, the closing position must result in optimum intercuspation. No major adjustments should be carried out after the try-in. The dentures are returned to the dental laboratory for completion. The completed dentures are incorporated. The final check of the bilateral balanced group guidance, the aesthetic appearance, statics, functions, and phonetics shows that the dentures are fully functional. This prosthetic solution helps patients to regain an important part of their quality of life.